Celebrity Smile is brought to you by Dr. Terri Alani. Whose pearly whites are these?
That would be Mr. Jerry O'Connell. Beautiful teeth. And speaking of teeth, from yellow teeth to broken teeth to no teeth, anything can be fixed these days, from teeth whitening to dental implants, and there's only one person that can do it. And we love her. Dr. Terri Alani is here with us to help us grin ear to ear and actually feel good about it, because that's what a lot of this is. I mean, it's you open your mouth, you talk, you want everything to look great, but there's a lot of things that we can do, from simple to a little more structured.
You know, it's interesting, Christina, because besides your eyes, your smile is probably one of the first things that people notice.
Absolutely.
So now with all the cosmetic options, there's no reason to have an unattractive smile. I think it gives you more confidence, a more youthful appearance. And it's interesting, because I tell patients, go home, look at your teeth. Look in the mirror and see what it is about it that you don't like, and don't be afraid to ask your dentist. You know, a lot of patients come in to see us, and they're so apprehensive and nervous about asking us questions, but that's what we're there for. We're there to help you get a better smile.
Right, and everything's fixable. And I'm like this, wow, those teeth are white. Look at Dr. Alani's teeth.
I have to have white teeth.
Which we're going to talk about in a second. But first, we're going to talk about improving your smile. We've got some, the Smile Makeover.
Exactly.
Which, okay, so
here. This girl presented herself, as you notice, she's got some oddly shaped teeth. And the two teeth on the side of the front ones, they're called peg-shaped laterals. A lot of people have that. It's very simple to correct. Usually you can put 2 veneers there. In this case, the patient had 4 veneers.
I can see that.
And it gives her, you know, she takes care of her hair, her nails. Why not have a nice smile?
So that tooth right there, that's, I always call it the fang.
Yes,
it's not. It actually has a name. And those can be fixed too. Okay, that looks really great. And this can be done fairly quickly.
Yes, very quickly. This is done in 2 visits, actually.
Okay. So sports injuries, when people are not wearing mouth guards or badly damaged teeth. Oh, wow. So that
okay, this patient actually was not wearing a mouth guard. First and foremost, you need to wear a mouth guard if your child is going to play soccer, football, basketball, but a lot of kids don't. So we see these accidents. This patient was a football player, had his tooth knocked, and basically what we do is we build it up with a build-up and then do a crown. And in this case, the patient also wanted to fix the 2 front ones, so we ended up doing 3.
Okay, and obviously
you get a great result.
Match it fairly quickly. Wow, okay, so, and then, well, that one's almost missing, but here we have missing teeth.
Now, this patient actually was born without those teeth, and that does happen. And nowadays, I think, if I'm not mistaken, this patient had 2 implants put in, and also 2 on the bottom, so we don't have to cut down the teeth on either side of the space. But then also, if you notice, the 2 front teeth were not shaped quite correctly, so ended up doing veneers on those 2.
Now this looks like somebody that may be a little bit older, but this is going to be something as soon as like as a child you're help me out with the terminology.
Okay,
your teeth that you have as an adult, you can do it as soon as those come in.
Well, actually, in this particular instance, you need to wait till you're about 20 years old, so the pulp has receded enough so you don't go and damage anything.
Oh, that's
so
good
if
to
you
know.
have a child that doesn't have these teeth, you want it, they can wear like a removable appliance for a while, and then as they get older, then we can opt to do implants.
Got it.
But you wouldn't do it until they were a little bit older, until the bone is formed.
And then our next one, we're actually talking about older teeth and how to make them look younger.
Right, exactly. This patient is, as you can tell, their teeth are worn down, they're a little bit discolored, they're not evenly spaced. It was an older gentleman. As we get older, our teeth do wear, they do get yellow, and there's no excuse for it anymore because of all these options. So we lengthened the teeth and actually put crowns. And you can just see, I mean, he's got more confidence and he feels better about himself.
Absolutely, the smile is better. Man, if you eat as much as I do not want to see what I'm going to look like in 10 years. Eating and eating and eating, just going down. Okay, so then missing molars is next.
All right, if you're missing, a lot of people are missing back teeth. So what you can do, there's 2 options here. In this case, what was done was a 3-unit bridge, and the patient did not want gold, so when they smiled, it was a more natural appearance, and we had natural materials. But you can also now put implants in, and an implant just replaces the gap.
Okay.
Just the one tooth in the gap, so you don't have to alter the teeth on either side of the space. So either one.
Implant sounds painful.
Not really. It's about a 3-appointment procedure actually, but we refer to a periodontist or an oral surgeon to actually put the implant in place. They wait 3 to 6 months and they come back to us to have the crown put over.
Oh, okay. Now with something like this, because obviously you have to have molars, is insurance able to help with it?
You know, some of the plans do cover and some don't.
Okay.
So it just depends on the plan that the patient has.
Got it. Okay, now this one, obviously, next one is a favorite of mine.
This is my favorite.
Teeth
Everybody
whitening.
should have white teeth. There's no reason not to have white teeth. And I whitened mine. I love it when people come in and want their teeth whitened. The best patients as far as whitening goes are the people that have yellower teeth. Gray teeth don't whiten quite as much, but yellow teeth whiten fantastic.
Why is that?
It's just the way it works.
Huh.
It's just, and everybody's teeth, well, people come in, they go, well, I don't want my teeth white. Well, they're not going to get white. Usually they'll only get as white as the white of your eyes.
I want my teeth so white they're blue.
Yeah.
Almost.
Well, you're getting ready to get married, so you need to get, your teeth are perfect actually.
Well, thank you.
They'll look good in your pictures, but I also noticed after I got my teeth whitened that when I get my photos done now, that's basically what I see. And it looks good. And it gives you more confidence.
And it's not very expensive anymore.
No, it's not very expensive. You can get the in-office done, which is an hour for around $500. Now there's also a pack that you can take home that costs $100, and it's a disposable, and it's for 7 days.
Okay.
You just
and
do
then
it
it
every
lasts
day.
for how long?
Well, whitening can last permanently. You just have to touch it up about every 6 months to a year.
It wasn't bad, unless you drink Coke and coffee, and you just got to take care of it. Okay, so the next one is fillings. I know a lot of people have the fillings with the
silver
color.
fillings, we do not do silver anymore. We have patients come in all the time and they go, oh, Dr. Alani, I don't want silver. And I'm thinking, I haven't done that in 25 years.
Yeah.
Everybody does. And you can tell as far as people that are updated by what's in their mouth, because white fillings, natural looking fillings, are a little bit better for your teeth. They wear better. They don't get decay around the margins like the silver does. Plus, the silver has mercury, and they've actually banned silver fillings in Northern Europe.
Oh, good.
You cannot even do them anymore. So when you smile, you know, a lot of people will smile and they've got gray showing from the fillings. Get rid of it and get the white fillings.
Yeah, then you can laugh and you can feel good and confident that nothing's back there.
Exactly.
Thank you so much,
All
Dr.
right.
Terri Alani, for being here. You can give her a call. She's great, wonderful, so nice, not intimidating. She'll give you some compliments, 713-621-5141. And now to somebody that has a beautiful smile and very white teeth.